Good morning, good afternoon, good evening. Thank you for joining my broadcast. Thank you for watching and listening my presentation. I'd like to start by asking you a question. How many of you have seen a doctor in the past 6 months? And what was your experience? And subsequently, I'd like to ask you another question. How many of you needed a doctor but was not able to secure an appointment because the doctor was out of office or out of the country or on vacation, or simply they didn't have enough appointment for you and you had to wait 6 months, 8 months, or a year? It has happened to me many times, especially if you want to see a specialist, you have to wait 3, 4, 5, 6 months, sometime a year for that to see that specialist. What if I tell you that these are all possible, that you could see your doctor? Wouldn't it be great and desirable if distance wasn't a determining factor to go and get good quality health? Wouldn't it be great and desirable if you are at center of your own health? Wouldn't it be great and desirable if you and your medical team that you select from wherever you want, a doctor from US, maybe a surgeon from UK, radiologist from France, cardiologist from India or South Africa or Asia or Russia, somewhere around the world, be all on one meeting with real data and go over your results, sharing images, sharing blood results in a secure and private setting? Wouldn't it be nice to have that kind of meeting at any time you want? Wouldn't it be great and desirable if you could get an accurate diagnosis of your issues based on historical data from people all over the world, with a library of diagnoses based on your symptoms? And even better than that, wouldn't it be possible, or wouldn't it be great if you could get a short-term or long-term prediction on a trend analysis of your health at your fingertip? I tell you, yes, these are all possible. Yes, these are all possible only if we design a taxonomy and architectural pattern, okay, for an ecosystem to be able to provide this kind of system, this kind of capability. It has to be interoperable. You have to have all the devices and the electronics all interoperable. Privacy and security with high performance. It has to be interconnected, flexible, quantum-based biased algorithm. That means that most algorithms are biased. They're biased with more data on one sector of the society, on one class of society, on one race, one political thing. You don't want to have any of such biases. So use of quantum can make it unbiased and have a standard protocol. So you have to design the system, but that's not enough. You can have technologically system available, but beyond that, there are social and other avenues that you have to be looked at. You have to look at socioeconomical factor, trust factor, which is really important. People need to trust that system. Operational and data governance, regulatory. There are a lot of regulatory in terms of patient privacy and interoperability and security and safety. All of those are other aspects beyond the technological that you have to look at. Technology is here, and it's moving very, very fast. I did a little bit of study, and it showed that since the Ice Age, since the caveman, even before caveman, 2.5 million years ago, till mid-20th century, there were only 35 key in innovation and revolutionary ideas and changes in the societies. Only 35 in 2.5 million years. And then in the last century, there were only 7. Okay, so just imagine in 100 years, 7, in 2.5 million years, 35. So that's almost fifth of 2.5 million in only 100 years. And then even better than that, in the last 1 to 2 decades, like in the last 20 years, there were only 3 revolution in the technology. So you can see the rapid changes that are happening in front of our eyes. In the past 20 years, there were computer revolution, become smaller, faster. Internet, getting access all over the world at your fingertip. And then recently, which is nearly not recent, it's been in the academic for so long, but the AI, which I would call it the data revolution, data transformation. It's all about data, how big, how much data, how fast can it process certain data. Those are the 3 that happened. So technology is rapidly happening. And technology is here, motivation is here, the desire is here. So let's go and get it. Let's do it. I'm Hamid Ghazawad. I'm a fellow classmate in your 582 class with Professor Reza. I'm a grad student at School of Electrical Engineering and Computer Science at North Dakota University. I have my email here that you can get in touch with me. I'm a senior program manager at Northwestern Mutual. It's a financial, it's a mutual investment company. And I'm also adjunct lecturer at Northwestern University in Evanston, Illinois. My topic, whatever we said, is an ecosystem. At the core of such a healthcare ecosystem is a patient-centric electronic health record. And that's the topic of my study, a patient-centric electronic health record. So my topic that I selected is a survey of advances and challenges in implementing a patient-centric electronic health record. And what is EHR, electronic health record? What is it? It's really a simple way, it's a collection of patient demographic and health-related information. So everything to do with a person, health. Your name, your last name, your telephone number, your zip code, your social security, your credit card, that's the demographic part. And then any health-related information that you've had in your life, it would be in the system, whether being structured, unstructured data, from a doctor, from a lab, from a radiologist, from cardiologist, from any center, offices, and labs, it would be in this. That's why it's so critical that privacy and security be maintained in all these systems. There is also another term, they call it EMR, electronic medical record. What is it? What is EMR and what's the difference between EHR? So EMR is at one center. Let's say you're going to a doctor for many years. So the doctor has his own information, his own system in his own office. Simple, one location. You go to a laboratory, you take a blood test, and they have your result at that lab. That's a different system. So this system is called EMR. And then EHR is a set of all this information across the globe in for you. Okay, so that's EHR. So EMR is a subset of EHR. What are the characteristics of such a system? The key quality attributes of an EHR is it has to be interoperable. And there is a standard called HL7 FHIR. It's a Health Level 7 International Fast Healthcare Interoperability Resources. So you have to comply to that in terms of interoperability of the devices. It has to be scalable, maintainable, usable, reusable, and many other of these characteristics. And you can see why, right? I mean, we've read it. Professor Reza has explained it many times about the systems and, you know, whether being avionic system or health system, all those, any single one of these characteristics means something. And this system needs to have that. And at the heart of it is improving decision-making through better data integration. And what are the challenges that we're facing with implementing such a system? Is integrating heterogeneous devices and systems. So interoperability is an issue because these are all heterogeneous devices. They don't interoperate with each other. So you have to find a way through some mechanisms, through some protocol, be able to connect. So that's one challenge. Sharing information, data exchange, data model. Okay, each system has its own data model, which is not compatible with the other system. So how do you make these systems, the models work? Accessibility, privacy, and security of these data, they're all at the heart of it. So these are challenges that we have. And beyond that, the data is fragmented across multiple systems. How do you bring this data? What kind of ETL are you going to be using? What kind of API do you have that the data come in? Those are all challenges, but nothing unusual. I mean, these exist in any system you create. You have to address these issues, and certainly EHR is no different. But the technology is there. It's just you have to go after it and try to solve this problem. What is a blockchain? So you hear a lot about it. It's really nothing other than a chain of blocks. Okay, it's a secure way of sharing and storing data. In this case, it would be your medical record and medical data. It is analogous to a linked list. If you had the database, not just database, but the data structure class in your undergrad, you've seen the linked list. It's a node of connected nodes which are referencing each other. So blockchain is, again, same as linked list, is a set of blocks that are connected to each other, and each block is referencing the previous block, which in this case, they call it hash. It's a cryptographic number. It's a hashing system. It gets generated. It's very, very difficult to break into it or break that code. And so just the system only knows that it, who is the person behind it. And that's how they maintain the order into the chain. It's a decentralized system. There's no center that controls it. And also, it works based on consensus mechanism. And what it is that if you want to change the content of your block or your node, all the nodes in the system, they have to agree and consent that you are the owner. And that's why it makes it so safe. And imagine if you scale this system, it would make it so difficult for one person to really hack into the system or be able to access somebody else's data. So that's called proof of work, the way they do consensus. And proof of work, it's very difficult because each node has to find the previous node and vote that, yes, I'm this person and that person. So it goes around the entire system to find out if this person is the right person to change the data in that block and the right owner. And that takes a long time for a bigger system. And that's why POW is really difficult. And a lot of people don't, they research, there are a lot of research going on of how to, address the POWs. On the other hand, a simpler case in Europe was submerged, and that's POS, proof of stakes. And that says that if you want to participate in consensus, if you are the owner, you need to identify yourself and you need to put your node, put your block as a collateral. If you are not the owner, you will lose your nodes. It's like a betting system that, you put it in, you may bet and you may lose. So you may lose it. And on the other hand, if you win, if you're the right owner and your blocks win, you get rewarded with another block. So you get a free block. So it's a lot simpler, but even that is a little bit hard. The purpose of my literature review is not to compete, is not to select, is not to purchase. It is to understand, to learn, and to augment my knowledge about the domain, its implementation, and advances in technology, and what people have done. That's really what I wanted to learn from this survey. what has been going on, add to my knowledge for future studies. So my paper looks at the selection of the study literatures with several angles, from different angles. Okay, I've used, I've read and looked at several hundred article papers and books, and selected a few based on these questions that I had. So essentially, how did the blockchain or any other implementation make the system patient-centric? So usability. So how do they use usability? How do they address performance? Because that's very important, fast. Performance is an issue. How did they measure the breaking point once the system start degrading? So as you add more nodes, systems start degrading. What is that breaking point that performance degrade? So that's scalability. So how good the system is scalable? What are these papers talking about, the scalability? How easy was it to make a change to the content, changeability? So as you can see, all of these areas addressing something that we've read or we've heard in our class from Professor Reza. So essentially, these are the kind of thing that I'm looking for in the paper, because essentially this will help us to implement what we're looking for. How did they address security and privacy, which many quality attributes contribute to that security and privacy? These are my sources from IEEE, from libraries, Google Scholar, and many other sites that is available to you for reference. You can take a look at it. I'm not going to go through this. This is a list of literature that I selected, each of them talking about different things within this domain. Again, I'm not going to go through it. I make the recording available to you. You can see it. If you have any question, let me know. And what I found out from the summary of all this literature review were that I actually learned significant amount of information and knowledge from all these papers. Each paper gave me some ideas, some knowledge. And then beyond that, I developed a taxonomy. It helped me to really put my mind together, create a taxonomy that I could put these things in order and be able to have some categorically, be able to categorize these papers for my future usage. And I came up with the taxonomy that has three high-level sections: the focus area, the methodology, and key contributions. And what each is that in the focus area, things like security, IoT integration, interoperability, ethic, policy, energy consumption, data architecture standards, what these papers contributing to this area. Focus, that's their focus. What is their focus? What methodology are they using? Is it a case study? Is it an experiment? Is it a survey? Are they introducing a new framework? What are they doing? And then the key contributions that they're making. What is it? Are they contributing to the security issue, interoperability, algorithm? Are they defining a new algorithm, a new framework? Policy recommendations, what are they recommending? Standardization of interoperability protocol, because these are important for my study. I put them as my taxonomy, and then I evaluated each paper based on that. And putting all this together, I've come up with this table. You can see the left column on the left are all the papers, then the focus area, then talk about the methodology, what they use. There is a summary at the middle, and the fourth column is a summary, then pros, cons, and their contribution. What have they contributed to this field? I have a couple of pages of that. Again, I'm not going to go in detail into it. This is available, as well as in the backup slides. I also have one slide per paper, a couple of bullets saying what their contribution of this paper was. So very simple. I made it available to you, so for your leisure. In the summary, I reviewed multiple papers on blockchain, on IoT health devices, healthcare, and AI fairness. Again, as we discussed, fairness is the racial, economical, political fairness. So there are several papers in this area, so I gained a lot of knowledge on that. And also, I learned the gaps that there are in this field, scalability, governance, and data standardization. Really, there's no one solution for that. And, so that's an area that is gap. Challenges, security risks in edge computing and blockchain solution. Edge computing is that, people are saying that, you take all this data, you send it out to a central location. There is a communication distance, timing, and all those. So they're suggesting to have a kind of credit card local disk, okay, the local storage, if you want to call it. They call it edge computing. And then you have it local, and then for more important stuff, you send it to the central location. But then there is a lot of risk to that implementation. So scalability concern, regulatory concern, these are all some of the concerns. Future direction, developing a standardized framework for EHR interoperability. So that's really one area that needs to be worked on, because this is the first step toward what we talked initially about patient care, being able to have a smart health system. This is the basic of it. Development of database management system, because at the heart of this EHR is a database with all this information, secure and private. And advancement in AI and blockchain for secure patient data sharing. This is really future direction. At the end, the question that I had to answer, is blockchain suitable for EHR? I would say not. But by careful implementation of a hybrid of architectural style, because one style doesn't address the whole thing. So you need to look at all the style, all the architectural quality attributes, come up with the style, a combination of style and patterns, and also a database management system, a strategy and data governance, and all this. If you put them all together, you will have a powerful and potentially a viable blockchain solution for EHR. Thank you for watching. Thank you for listening to my presentation. I really appreciate any and all feedbacks, good, bad, or otherwise ugly. Thank you. Stay safe, and God bless, and looking forward to your reviews.